So I now have great pleasure in inviting our first speaker, Dr. Lauren Christie. Lauren is an occupational therapist. She's a clinician researcher and the Senior Implementation Science Research Fellow in Allied Health for St Vincent's Health Network in Sydney. Dr. Christie's PhD studies focused on clinician behaviour change in stroke and traumatic brain injury rehabilitation using implementation science methods. The title of Lauren's talk is Walking the Tightrope as a Clinician Scientist. So thank you, Lauren.
Thank you very much, Kathy, and thank you to the Academy for the opportunity to present to you all today. My journey as a clinician scientist started way back in 2009. As Kathy has mentioned, I'm an occupational therapist, and a couple of years out of university, I was working on the stroke unit at Bankstown Hospital in southwestern Sydney. In my time there, we'd started a program to target dressing retraining practice after stroke at a time when our staffing levels were low, as a way of ensuring people were getting some regular activities of daily living retraining in line with the National Stroke Guidelines. The unit had a strong culture of research at the time. Carl Scher and Dr. Simone Dorsch, who you may know as research active physiotherapists, were senior clinicians on the unit at the time, and Dr. Kate Scrivener, another physiotherapist, was completing her PhD studies part-time on the unit. As a rather green clinician with a lot of curiosity and having found my passion for stroke rehabilitation, I came to the conclusion that in order to become the best clinician I could be, engaging in research would be a really great step forward. At the time, an academic, Dr. Annie McCluskey, who's also an occupational therapist, was regularly visiting the unit and heard about our quality improvement project over lunch one day. She advised myself and a colleague that there'd been limited research published in the area, and would we consider further developing our QI project into a small research study. That study resulted in my first peer-reviewed publication and the opportunity to present at national conferences. I was then offered the opportunity to do my Master's by research on the same topic, but instead decided to pursue a long-held dream of working and travelling overseas, so ran away for a little bit. Upon returning to Australia 3 years later, after working in both the public and private healthcare sectors in the United Kingdom, and still with a keen interest in research, I commenced my Master's by research part-time through the University of Sydney in 2015, whilst working in a full-time clinical role as the inpatient program coordinator at Liverpool Hospital Brain Injury Rehabilitation Unit. My topic for my research within my master's degree was focused on constraint-induced movement therapy, or CIMT, a proven effective intervention for arm recovery after stroke and traumatic brain injury that's strongly recommended in our national stroke guidelines, but not routinely offered in practice due to a range of therapist, resource and patient-related barriers. And whilst working overseas in the private sector with greater flexibility in funding models, I'd been able to offer this intervention more regularly and seen some excellent clinical outcomes. So I was interested in how I could translate that into my work in Sydney within a public health setting. In 2016, I applied for and was successful in receiving a New South Wales Health Translational Research Grant to conduct an implementation study across 9 neurological rehabilitation teams at 5 hospitals in southwestern Sydney Local Health District, called the Active Arm Study. This funding allowed me to reduce my clinical role at the brain injury unit to 3 days a week with funding for backfill, and to work as the principal investigator and project coordinator on Active Arm 2 days a week for a 2.5-year period. Active Arm was comprised of 4 studies and built on earlier work within my Master's by Research program, which had explored the factors that had supported clinicians internationally to successfully implement and sustain CIMT programs over time. Active Arm provided me with the opportunity to upgrade to a PhD program of research. I designed, then tested a behaviour change intervention to help support occupational therapists, physiotherapists, and allied health assistants to change their practice and deliver CIMT programs more routinely within usual care and existing resources. ActiveArm also explored participants' experiences of receiving a CIMT program and an economic evaluation of the cost effectiveness of CIMT implementation. ActiveArm resulted in over a 50% increase in the proportion of eligible stroke survivors and people with brain injury who were offered and received this evidence-based intervention. And these changes in practice were sustained 6 months after withdrawal of our implementation support. Following completion of ActiveArm and returning to my full-time clinical work, I missed having the opportunity to wear both my clinical and research hats. I was notified by an external mentor that a full-time allied health research role had become available at St Vincent's Hospital, and I was successful in obtaining that role and transitioning to my current position in late 2019, where I support other frontline allied health clinicians to engage in research and with a focus on increasing allied health research capacity. In focusing on the benefits of having a culture that supports allied health clinician scientists, I wanted to share with you some of the outcomes that we achieved through ActiveArm. From that project, that single project, we achieved a range of successes that go far beyond simply the research outputs. Using the translational research grant funding, I was able to employ an occupational therapist and physiotherapist part-time as research assistants who had an interest in research. Both of those clinicians are now enrolled in postgraduate research degrees and also remain clinically engaged. So ActiveArm provided the opportunity for us to increase our allied health clinician scientist workforce capacity. We were also able to upskill 9 teams across 5 hospitals in research processes, from consenting participants to assessment and delivery of interventions and supporting data collection. We now have an upskilled workforce across southwestern Sydney who were not only research engaged, but will be ready to take on future projects. And I'm now mentoring one of these staff members who's recently commenced in his first role as a part-time clinician scientist. For myself individually, it improved my skills as a clinician. I now feel like I'm a much better clinician than I was before I started my research degree. I'm able to appraise evidence. I'm better at selecting the right intervention for the right person at the right time. And I'm also better able to provide education to patients about what their options are in terms of interventions and the likely benefits of those. Finally, and most importantly, were the benefits for patient outcomes. Patients at the participating sites within ActiveArm now receive a strongly recommended evidence-based intervention that was difficult to access before, and they achieve both statistically significant and clinically important improvements in their arm function and performance in occupations. In terms of the challenges as a clinician scientist within allied health, one of the biggest challenges was balancing 2 very busy jobs, both my role, my clinical leadership role within the brain injury unit and my research role with ActiveArm. Both of them could have been full-time jobs in their own right. And so fitting both in the space of one position was at times challenging. It can also feel quite isolating at times being a clinician scientist. You don't really fit in with the students who are studying full-time, and there's less opportunities for you to engage with other research students because you are working in a frontline clinical role. Within your clinical role, it also sometimes means that you feel that depending on the culture within your team, that the research is somehow seen as quite separate from your day-to-day job as an extra thing that you do. And that in and of itself can feel quite isolating at times. There's also a real lack of roles and opportunities for career progression for allied health clinician scientists like myself who wish to remain embedded within the health service and to use their clinical expertise whilst also conducting high quality research. For myself, I'm grateful for the opportunity to now work in my full-time research role at St Vincent's, where I'm supported to pursue ongoing research in my areas of interest in stroke and TBI rehabilitation. However, my current role doesn't have a clinical service delivery component. So I've maintained my engagement in clinical work through continuing to work on a casual basis as an occupational therapist at Liverpool Hospital and contributing to external teaching. The options for me were limited at the time of heading towards the end of my PhD. I could continue on a clinical leadership or management role track or move to academia, when in fact I really wanted to have the melding of those two positions. So I think in particular, we need to look at models for embedding clinician researchers within health services, particularly in the field of research where I work in implementation and knowledge translation. Frontline clinicians are best placed to tell us what will work and what won't work, and how to integrate research into existing care pathways. And I think we can learn a great deal from conjoint academic position models like those used in medicine around ways we can best support staff to achieve that outcome. We also know that research active health services have better outcomes. So looking for opportunities to build on that to maintain an engaged workforce is also really important. In terms of enablers and strategies that help to support me in undertaking research whilst working as a clinician scientist, completing my research degree has been the most rewarding experience of my professional career. Not only have I learnt a whole lot of new skills, it's fed my curiosity, and I've had the opportunity to challenge myself and also to work with some incredible people. Having protected time to work on research is incredibly helpful. So I would encourage any of you with an interest in research to look for opportunities for funding, both big or small, that allow you to buy out some of your clinical time to be protected to undertake research, and for managers to be able to backfill your clinical position, because it can make a big difference in terms of your study progression. Small pockets of money, whether it be through internal funding opportunities at your health service or external larger funding bodies like New South Wales Health or other statewide organisations or national funding bodies, can also help with things like research assistant support, hiring by a statistical consultant support, and also would encourage you to look at opportunities for student engagement with honours programs to help you with some of your smaller project ideas. Another really important component was having advocates and support within management. My frontline director was incredibly supportive, Matt Jennings, the Director of Allied Health at Liverpool Hospital. He helped me to develop networks as well as gain support from a number of the sites involved within Active Arm. It's also useful to develop your networks with other clinician researchers, because they can be a really great support network for the times when the study can be quite challenging. For me, this involved developing networks with other occupational therapy clinician researchers who are based in Melbourne, who work in a similar field at Alfred Health, and who are now my ongoing research colleagues and friends. I think having a supportive supervision team is also critical, and I'm really grateful for my 3 amazing academic supervisors who supported me throughout my research journey. And also look at opportunities for having external mentorship if you think it would be useful. I have external mentors both within my discipline as well as in other disciplines, including medicine, and they really help to build my ideas, to challenge me, and to provide new perspectives in my research journey. So in terms of take-home messages, for those of you who are considering dipping your toe within research, the most important thing I would say is I would really encourage you to go for it. Look for opportunities to really just start to get a feel for research. That might be assisting with data collection within a larger study, even if you aren't running the project yourself, or considering enrolling in a postgraduate degree. I think it's really important, though, to select a research topic that's relevant to you. It's a question that you're going to be looking at for quite a while, whether you're doing your studies on a part-time or full-time basis. So ensuring your question is relevant and meaningful to you, your practice, and most importantly, the patients you see every day is really important to help you maintain motivation at the times when things get hard. As I've said, make sure that you look for opportunities to develop a support network, and always remember research is a team sport. I attribute a lot of the success of Active Arm to working within a great team, and that included other allied health clinician researchers, Reem Rendell and Nicola Fern, who worked with me as research assistants on the study, as well as having advocates and supports within the broader allied health management team across Southwestern Sydney Local Health District. So in closing, I would encourage all of you who have an interest in research to go for it. Your first step might have been enrolling in this webinar, but you never know where the road might take you. Thanks very much.
Thank you, Lauren. It's a shame that you can't hear all the clapping, but that was fabulous. And I love that you're talking about this, such a much better clinician having engaged in research like that, and the impressive amount of influence you've had already, supported by the wonderful Matt Jennings. There are a few questions for you, Lauren, but we'll hold them over to the end, if that's okay. So don't forget what you've done in your life, because it will come back to ask.